peptide, which is collagen, or ectonidine, which contains surfactant. Surfactant is amphiphilic component, that means hydrophilic and hydrophobic at the same time. So it will lyse everything. It will lyse the slough, the bacteria, the fungus, the spores, anything in the wound. And according to your dressing, it will be collected in the dressing, then you can remove it. Biological dressing, we will see it inshallah soon, because I heard that they are trying to bring this company which harvests this or working in this to make it sterile, the green fly. They are using maggot which eat the necrotic tissue, not the healthy tissue. How they don't eat the healthy tissue? Because this larva secrete enzyme that destroy the slough, but our own cell, the alive cell, it have the inhibitor. So it will not eat our own cell. But you can see if you have patients with this, you will feel disgusting. So they call it Uki effect. Yeah, when you see the patient. But it's really working because it is available, I mean in the life, but it needs really to be sterile and it needs specialized person to handle it. Mechanical debridement, I am sure maybe we are using, for example, US in our hospital, which clean by mechanically when you wrap. Soften because it contains molexima. It contains also allantoin as a soothing particle. So also this one, debris solve, how it will act by the filament. By the tiny filament, it holds the bacteria. Hydrosurgery, I hope also, I don't know about the wound care and others, but I think we should harvest in wound care to adopt the debridement modality in the same room. But unfortunately, still we are working in this. But I hope one day we'll have this modality, hydrosurgery using the water, ultrasonic debridement using the ultrasound to make a cavitation and then remove by water jet. And finally, this is the molecular light. I don't know if somebody here. This by fluorescence, it will discover presence of bacteria that contain porphyrin or boviviridin, this component, like for example the Pseudomonas. So you will do debridement until the color of this cyan color removed, then you make sure that your debridement is good. I have a lot of things to tell, but I think by this I conclude my presentation. Thank you very much.
You want extra information from Dr. Turki? He is welcome to have another lecture. Thank you, Dr. Turki. Really, it was informative information. And you add more about wound. We're sharing with you today. We have also another consultant, Dr. Arif. She's a plastic consultant. She will talk. Actually, she chose her topic by herself. Okay.
Assalamu alaikum, good morning everyone. I'm Dr. Arif Bijhani, plastic surgery consultant, breast reconstructive surgeon. As Mrs. Arwa mentioned, I chose my topic. It's a bit away from the common practice. It's a new thing for me and I think for others. So let's explore how traditional medicine before affect the practice in the wound care. First of all, we focused in this conference about the wound care because usually we consider the chronic wound as a silent epidemic. Globally, the percentage of chronic wound reach up to 1 to 2% in the developing countries. So we can consider it as a silent epidemic according to this study conducted in Malaysia. And prevalence increasing with with the age. Okay, then before the era of modern pharmaceutical component, the traditional medicine is the one prominent. So it's mainly relied on the cultural knowledge, the empirical observation of the plant and minerals, and how to implement this to improve the tissue repair and prevent the infection. So if we go through the historical context, previous civilization, the first civilization we go through is the Egyptian one. So the Egyptian, they use the animal-based, which is the honey, mainly. They use other like animal fat and implant-based, but the main is the honey. For the Greek civilization, they use a lot of implant-based structure like the aloe vera, per se, and also they recommend it in their document. The Indian civilization, they use a lot of implant-based remedies like the turmeric, the neem, and the sandalwood. The traditional Chinese medicine also, they use a lot of implant-based like ginseng and other. And the Native American, they use also implant-based mainly. So these practice usually it's based on their special belief and ritual, and they reflect their holistic understanding of health and healing process. So if we go through the key component on how traditional medicine or how herbal medicine affect wound healing, it's broadly that way. Either it's anti-inflammatory or antimicrobial or wound healing promoters. The most common known, the anti-inflammatory is the turmeric one, usually ginger and other. For the antimicrobial, the honey, also the other, but honey is the main. And the wound healing promoter is the aloe vera. If we can classify it, the traditional medicine, we can classify to animal-based, implant-based, and other. So for animal-based, honey is still the queen of the all animal product and have very strong antimicrobial effect. Also, we can introduce the fish skin, which is used as biological dressing nowadays, and animal fat. Also, mineral application, we can also the use of clay as a good absorption and have antiseptic property. Well, we do not forget to mention the physical therapy, the effective massage, and the compressors for the effective wound healing. So, while the historical use of extensive, still the evidence needs a lot of good evidence to support the use of traditional medicine in the modern wound healing process. A few areas to concentrate if we talk about traditional medicine. First of all, the phytochemical analysis. The researchers mainly concentrate on the active component. Like, for example, they concentrate on the component like the flavonoid, the alkaloid, and the terpenoid, and they affect if the anti-inflammatory, antimicrobial. So if we took the curcumin as an example, it has extensive study related that it's a very strong anti-inflammatory that way, and very crucial in the wound healing. Also, a lot of study conducted in vitro and vivo, and the laboratory study usually concentrate on how affect the herbal extract on the tissue itself, and what's the effect on the fibroblast and keratinocyte per se. In the animal study also they see the effect on the traditional medicine and living organism. And also show how traditional medicine affect the increase in collagen production and enhance angiogenesis and decreasing the bacterial load. So as we know, the randomized clinical trial is the gold standard to see the effectiveness of any medical intervention, and compared to pharmaceutical drugs, still the traditional medicine remedies have fewer randomized clinical trials. So increasing in number being conducted now also, this is something to promote us to look for this evidence. So I'll go through the examples of commonly used traditional medicine. I'll classify them again to implant-based and animal-based. Animal-based, the honey is, again, it's a queen. The animal-based, the honey is rich in antioxidant enzyme that provide the wound with a moist environment and inhibit bacterial growth. Usually because the antimicrobial activity due to the high content of sugar and the low pH, and also the hydrogen peroxide, which make it a strong antimicrobial. The clinical trial showed also the honey will promote faster wound healing and reduce infection in both burn and ulcers. Also, this is a recent study conducted it's a systematic review for honey wound dressing. A lot of conclusion, but mainly they made the characteristic of the honey make it a very good option for wound healing and reducing bioburden of wounds. So it's a good anti-inflammatory and antimicrobial. It's contained the protease enzyme which induces the scar tissue autolytic debridement. And also it's a good option for treatment of diabetic foot, diabetic ulcer and very difficult chronic wound. Next animal-based component is the fish skin. Maybe this is not very commonly used. We use the fish skin usually as a xenograft, as acellular fish skin. Usually they take it from the Atlantic cod or the Nile tilapia fish. And they apply it for the burn wound and the diabetic foot ulcer. It has very good and very strong anti-inflammatory and antibacterial property. Also, this is a recent study in March 2023 comparing the fish skin graft with other alternative wound dressing. Also, this is a systematic review in the literature. So, showed the skin fish is superior in wound healing compared to collagen dressing, to silver sulfadiazine, and to allograft. And this is overall improving overall superiority is because of improving quick and wound healing with fewer dressing change, less pain, and as we know, very less cost because it's a fish skin. Third animal-based dressing, Dr. Turki talked about it. It's a maggot therapy, or we call it larva therapy or larva debridement therapy. It's used involving the definite amount of medical larva. It's a live larva used in wound healing, disinfection, and debridement. As mentioned before, it's either can be applied as a loose or back dressing. Usually the larva is non-operator dependent. So the main effect of the lesion of the larva, it's reduce the local anesthetic. It's anticoagulant property, so it's cause blood thinner. It's also reduce the swelling and have some sort of antimicrobial. And our practice as a plastic surgeon, it's very important after tissue transfer under local fluid transfer because because of anti-inflammatory and also the blood thinner activity. It's good for to relieve the congestion after blood transfer. Next, we'll go to the implant base. Of course, if you talk about implant base, the first we talk is the aloe vera. The aloe vera contains polysaccharide with a lot of good evidence support that stimulate the fibroblast growth, which is very unique and interesting. So as long as it stimulates the fibroblast growth, it's promote the collagen synthesis. Then it have also other property like the anti-inflammatory, and it's used for the burn wound and also soothing for the minor wound. This study conducted in Texas, USA. Also, it's a recent one in 2021. So they found that the aloe vera-based dressing usually it's good for promote fibroblast proliferation and collagen synthesis for wound repair. Also the same, it has a good potential to be a good dressing, the aloe vera good candidate for dressing, hypogenic dressing. This scheme show from 2020 up to the recent, how many studies conducted about the aloe vera. From 1990, they showed that it's okay, fine. In 1990, it showed that the faster wound healing time frame. Then, with time conducted, they showed that it's even the good property in faster. What? In 1990, they found that it's a faster wound healing time frame, so they concentrate for the next generation also from 1996 to 1997. How it's increased the faster wound healing, increased the number of healed patients. Then 2014 to 2015, they focused that increase the wound healing, increase the plasma total absorbent capacity, decrease swelling, and decrease the bacterial count. 2019, they decreased the pressure ulcer, decreased the cancer risk, and increased the skin elasticity, which is very important. And until now, there is ongoing study about the aloe vera, because it's very unique components like the enzymes, the proteins, and vitamin and saccharide. Next is the turmeric. Turmeric from which civilization? كله قاعد يسولف مع from which civilization? India. Excellent. So turmeric have a good curcumin, which is a very anti-inflammatory component. It accelerates wound healing and reduces scarring. Recent study also support that the curcumin and anti-inflammatory property accelerate the wound healing and reduce inflammation and oxidative stress. And this study conducted and showed that effectiveness of turmeric is increasing with increasing concentration from 5 to 10 up to 15. As long as we increase the concentration of the turmeric gel, it will increase the capacity. Third implant base is the neem. نيم حتى بالعربي اسمها نيم. النيم have an active component like النيمابيدين and nebivolol. It has active component nimabidine, nimabidol, whatever component. It's a very strong anti-inflammatory, antimicrobial. Also, the neem contains large amount of amino acid and vitamins, and very good in proliferative wound healing process, proliferative phase. Again, also, this study support the neem can be used as a hydrogel dressing. هنا مش واضحة but this table with here the plant-based remedies, and this is the effect, and this is the evidence support. So we'll concentrate mainly in the aloe vera a lot, but aloe vera is the common with antimicrobial, anti-inflammatory process. The curcumin we use it, and the cumin, the eucalyptus plant also, the jojoba, the pine, and the green tea. All are strong anti-inflammatory, antioxidant, antimicrobial with supported evidence. So if there is some important consideration, the quality and the consistency of herbal medicine is varying significantly, and the interaction between the herbal remedies is still possible. So further research is needed to standardize this traditional medicine to common practice. Challenges we face that there is lack of standardization, as we mentioned before, and there is potential side effect like allergy from the remedies or herbal remedies. And we need scientific validation, as we mentioned, we need randomized controlled trial. And the sustainability, sometimes the extraction of the or over harvesting of the medical implant that affect the bioavailability of the component. So if we talk about integration with the modern medicine, and research is still ongoing about active component in traditional medicine to evaluate their efficacy. They standardize the herbal formulation. They use traditional knowledge to develop a non-wound healing therapy, the novel wound healing therapy, and combining the traditional medicine with the modern approach is more holistic and personalized approach in the wound care. Last, as a conclusion, we should know that traditional medicine has a long and rich history in treating wounds, while the modern medicine is revisualized. Still, the traditional practice offer a very good side and potential therapeutic concept. So by combining both the wisdom of the past and the advancement of the present, we can create a very good comprehensive effective method for wound healing. And we mentioned as again and again, we need further research and collaboration for essential bridging between the modern and the traditional approach. That's it. Thank you.
I have a question, Victoria. What what we will do if there is one patient, old lady, she refused to use our care and to use the traditional way.
This is actually we encounter the الحوجوة المرة every day, but يعني, this is still under trial, so we never encourage people to go for herbal medicine. Although even the Morra and Khawajawa have evidence-based, but as we mentioned, the bioharvest is effect, so we never encourage patients for any herbal remedies and stuck to our modern medicine till further evidence.
Thank you, Dr. Amin. Any question? Thank you. This is my lecture. I will introduce myself. I am Marwa Lamizi, wound care coordinator in our hospital. Actually, also I chose my topic. I want to know from the audience how many of us can see big wound, big traumatic wound. Raise your hand if you are tolerant. Wound care, they raise the hand. The others, they don't raise. You can see Ms. Hiba. Okay. Why I choose my... So there is impact. If you see bad picture for anything, you will have a facial expression in your face. Also, the patient himself, when he sees himself in the picture or in the mirror, he will also have impact. That's why I choose the psychological impact for the wound. Really, it affects all of us, the caregiver and the patient himself, his family, everybody. They are facing like fear to see this wound. First, we should understand the emotional impact of the chronic wound. If we have acute wound, and we have chronic wound, there is difference. There is difference in what? Time and the healing. So a chronic wound, it means take long time, and the patient he will be more depressed. But acute wound, it will happen with a certain time, and it will heal fast if there is no any health issue. Here down you can see speak, listen, talk, and think. Can you put this word in order for me? Choose which word we can see it first. Look.
Look, think, and speak.
Look.
Look, listen, think, and speak.
Think, listen, speak. Listen, look, think, and speak. First, we should listen to the patient before we are opening his wound, and we should concern him, we take him as a whole, okay? When the patient came to our clinic, we will ask him, how are you? You can't come every day, how is the wound with you? He will complain. He will say a lot of things before you are starting the dressing with him. Then look to him, look to his wound, open, and tell him you will open, and you will take whatever you listen to him, and we will see together. Then after you look to his wound, think with him. Involve the patient with you in the treatment. It really will affect the healing process. Then after he will come, let him speak again. You listen from him and let him speak again. If this treatment is good for him, he's suitable, he has any concern. Okay? Psychological effect of chronic wounds, we have a lot of things. Depression and body image and social withdrawal and isolation. The stress and anxiety. The patient will be more stressful and anxious about the result. He will tell you the first question, how long will take time? how many you see from your experience? Do you think this one will end? What's the end? How much it cost? He will think about a lot of things, and you will answer him. But really, each word from you, it's really affects in his stress and anxiety. You will relieve him at some point. Some of the patients they are stressed from the way you are doing for him the dressing. Some of them they are stressed how he will come to the hospital every other day for the dressing. Some of the patients he will think how much it will cost the dressing. He will go another institution. Maybe it's not free, not government. He will ask how much it costs. He will think, and this one is stress. The money is stress. Okay, and he will think, especially if the wound 3 weeks and he did not see any improvement, he will become anxious and he will not trust because you are not stuck with him from the beginning. Some of the patients, he will tell you, you told me 3 weeks, you told me, but still until now I did not treat it. We will discuss with him. Maybe you have another issues. Maybe you have another. You are diabetic. There is a lot of things affect on the wound. What the things affect on the wound? It's not from my topic, but this is the 5 things I am telling everyone. The 5 things affect in the wound healings. First thing is the blood supply. Maybe the patient he doesn't have good blood supply, like neuropathy in the diabetic patient, and also the effect of the dressing. Maybe the dressing is not effect for him. Okay, and we have also the transportation. It's also affect the psychological family support. It's affect. So it's umbrella. We should see all of them together. So he will concern about his non-healing wound, like what we learned from Dr. Turki today. He said we will not say not healing wound, we will say hard wound. And prolonged treatment process. Some of the patients, especially the diabetic ulcer, how many months do you think he will take? We have patients within 2 years not healed. Why? Because the sugar not controlled. And he feared from the complication of the infection. Some of the patients he divorced because of the smell of the wound. He divorced from his wife. Imagine that. Really, the wound is affect the social life. Some of the patients, because of the eviction and he don't want somebody see him, and he will be more isolated, more antisocial. So really affect on the psychological and mental health for him. So the chronic wound, it's really affects and lead to physical